Good evening, and thank you to all of our parents and stakeholders that have joined us this evening for a review of the 2020 school reopening plan. Our session from 5 to 6 is centered on our elementary program. We do have a number of submitted questions that we will be reviewing after the brief presentation. We also have an area within the chat that if you have questions as the presentation begins, that we would welcome you to submit those questions for our review. Just to introduce our school district pandemic team, our superintendent, Dr. Charles Prietel. I am Brad Hatchie, assistant superintendent and pandemic coordinator. Also on our team was Bryce Cossiter, our director of technology, Paula Foreman, our community relations director, Haley Flegel, our federal programs director, Susan Franks, assistant business manager for enterprise and fiscal funds, our high school principal, Andrew Neely, junior high school principal, Lori Mangan, elementary principals Jim Abbott and Rich Adams, our nursing department head Renee Weidlich, Phil Riccio, the school district athletic director, Jill Lane, our junior high school athletic director, Michelle Sanders, our director of special education, Doug Endler, our director of building and grounds, William Peffer, our director of safety and security and head security officer, and we have begun developing school subcommittees that are made up of teachers, support staff, and other stakeholders for building level planning. At this time, I'd like to introduce our superintendent, Dr. Charles Prietel, for a brief welcome.
Thank you, Brad. First, I'd like to say thank you to all the parents and all the students for all their hard work this spring and getting us through the closure that occurred in March, April, May. At this time, we're preparing to open in the fall. And today we're going to talk about what we have planned and how we plan to meet your needs as we move forward. Obviously, there are many challenges. We all see the CDC reports every day and what needs to happen and how we're going to make all these pieces come together. Hopefully today we're going to answer a lot of your questions and be able to raise your comfort level as we move forward. This time I want to turn it back over to Mr. Brad Hatch.
Okay, thank you, Dr. Prietel. We're going to move through a presentation and to briefly kind of go over what we'll be covering this evening. Our first and biggest priority is the health and safety monitoring of our students and staff. So we'll briefly talk about what steps and measures it will be taking to ensure the health, safety, and wellness of our staff members, as well as our families and our students. Talk specifically about transportation to and from school, what district transportation will look like, and then also the arrival and dismissal plans at our buildings. Specifically talk about our feeding program and our breakfast and lunch programs, how transitions will look during the school day, specifically talk about personal protective equipment, what the requirements are, how we're going to maintain social distancing, and promote personal hygiene with our students and staff. And then finally, talk about our classrooms and what those will look like and how the educational program will be delivered throughout this school year. And then finally, we'll highlight what the educational options that are being presented to our families and students and the process for making those things happen for the start of the school year. In terms of health and safety monitoring, this is very much a joint effort. This is a partnership between parents in the school district in terms of helping to maintain not only your safety, but also stressing the importance and safety of others. From a parent perspective, what we are asking for parents to do, and this is recommended by the State Department of Health, is to conduct a health screening of your child daily prior to school. What you should be looking for is any temperature greater than 100.4, coughing, shortness of breath, headaches, body aches, fatigue, diarrhea, runny nose and congestion, or loss or altered sense of taste and smell. If your child is experiencing any of these symptoms, please keep them home from school and consult with your physician. Be available and have a plan for your child pickup and update your child's emergency contacts. Information will be sent home at the beginning of the school year. We ask you to look at those very carefully and update any of your contact information and biographical information that can help us assist your children as we move forward. What you can expect from the school district is that we will conduct a health screening upon arrival at school of all students to include a contactless temperature screening. We will be monitoring of symptoms throughout the school day, and you will have frequent communication with parents and guardians if a child is symptomatic. Daily health screening and symptom monitoring of all of our staff, maintaining a clean and disinfected environment for students and staff, and providing sanitizer, education, and opportunity for personal hygiene. Providing face coverings for any student that are not available to provide their own. And then working with families and students on individual needs and concerns, as we realize there are many circumstances that are out there in terms of medical needs as well as individual needs with our students. So please don't hesitate to communicate with your building principals and/or district administration on looking at those areas. Transportation, arrival, and dismissal. The school district will provide appropriate transportation to any student eligible for district transportation. Our buses will be limited to 48 riders and vans to 5 riders. Face coverings are required on all school district transportation. Loading and unloading practices will be implemented to limit direct contact and maintaining social distancing. Assigned seating will be implemented and enforced, and students are required to wear a face covering when entering the building and exiting the building. Parent-provided transportation will be coordinated with designated drop-off and pickup locations to maximize social distancing. Upon arrival at school, students will report directly to their assigned classroom where the health screening will be conducted by their classroom teacher. Students will be able to acquire a grab-and-go breakfast that they will take to their assigned classroom. Hallways and locker access will be staggered to ensure social distancing. Movement throughout the buildings will be directionally assigned and monitored by staff. At dismissal, staggering will maximize social distancing, and dismissal will be coordinated by the classroom level and adhere to directional expectations. Parent pickup locations will be designated, and bus and van lineups will be coordinated to maximize distancing and limit any group gatherings. Our breakfast and lunch programs are highlighted. We highly encourage cashless transactions by utilizing our online payment options or sending in personal checks to our cafeteria department. Those can be simply sent into the main office of your designated building, and those will be processed by the clerical staff and the cafeteria staff. We will have a grab-and-go style breakfast option where students will then take their breakfast selection to the classroom to eat. Social distancing will be practiced in all food and checkout lines. Staff will limit contact by entering student information into the transaction system. Breakfast will be available to all students. Lunches will be staggered and spaced out to limit the number of students in the cafeteria at any given time. Tables will be spaced out, and the number of students at each table will be limited to ensure social distancing. Depending on your particular building, additional spaces will be organized throughout the school to make sure that students have adequate places to eat and adequate spacing for social distancing. Lunchtime schedules will be staggered to limit the number of students in food preparation lines, and lunch options may be limited to fewer choices daily. Students can always bring their own lunch to school. All feeding areas will be sanitized between lunch sessions, including student tables and all serving areas. Face coverings are not required while eating. Transitions during the school day. Some of our highest traffic times will be during school transitions. Therefore, transitions during the school day will be limited to necessary movement only. When possible, students will remain in a setting and instructors will move to their locations. All transitions will be staggered to allow for the minimum number of students to be in the hallways at one time. Scheduling modifications will allow for increased time in between classes to accomplish this. Students will be required to limit locker visits to morning arrival, lunch, and dismissal. All transitions will be monitored to make sure that students are practicing good habits and maintaining social distancing. Students are encouraged to hand wash and sanitize regularly throughout the school day, especially before and after their designated lunchtime. Face coverings are required during transitions in the hallways, including arrival, dismissal, and class change transitions. Personal protective equipment. All of our students and staff are encouraged to wear face coverings at all times. All students and staff are required to wear face coverings when social distancing cannot be maintained. This will include while on AASD provided transportation, upon arrival in the building until the student is in their classroom, during any transition in the hallway, at dismissal until the student has exited the building and been picked up or has arrived home by walking. In class, when social distancing cannot be maintained, when small group settings and individual working in close proximity with other students or their teacher are taking place. This will be directed by the classroom teacher. If special circumstances or medical concerns prevent the student from wearing a face covering, they will not be required to do so. Face coverings will be available at all schools and on school district transportation for students who are not able to provide their own. We are encouraging all students to provide their own face covering that they are comfortable with. The school district will have face shields in addition to cloth face coverings available at all locations. Social distancing and personal hygiene. The CDC and the Pennsylvania Department of Health have emphasized the importance of social distancing in preventing the spread of COVID-19. The Altoona Area School District will make every effort to ensure and monitor that social distancing practices be implemented and adhered to on a daily basis. All staff will be trained on implementing these practices and educating our students on the importance of maintaining social distancing. The CDC and Pennsylvania Department of Health have emphasized the importance of having personal hygiene practices, including the use of face coverings, frequent hand washing, and the use of sanitizer to disinfect their hands. All staff will be trained on implementing these practices and educating our students on the importance of proper personal hygiene in limiting direct contact with others. Water fountains will not be available to students. However, students are permitted to carry a clear water bottle with them throughout the school day. In our classrooms, social distancing will be maintained by providing individual student desks in all school district classrooms. Tables, kidney-shaped tables, and other small group tables have been removed from classrooms so that classrooms will be equipped with individual desks for all students. Desks will be spaced and organized to maintain social distancing. Instruction will be delivered face-to-face for all students every day. When class instruction involves closer proximity learning, face coverings are required and appropriate interactions will be monitored. Instructional materials will not be shared, and when there are instances when common instructional materials are utilized, they will be sanitized after each student use. Schedules are modified to ensure staggered transitions, limiting unnecessary contact between students and staff. Increased time will be allotted for transitions, and they will be monitored by staff to ensure safety compliance. An intention survey will be sent to all families tomorrow morning, Wednesday, July 22nd, 2020, asking you to commit to an attendance model. So please check your email as they will come via our SkyAlert system. Your schooling options, and this has been a lot of discussion surrounding, what are the differences between the variety of schooling options that are available to our families. Families will have the option to choose from multiple attendance models. A traditional model is where students will attend their home school on a daily basis. If families decide that they are not comfortable with a traditional setting, there are multiple options available. A virtual setting is where students are provided with their education in a predominantly online environment. They'll be educated by their classroom teachers during the school day. The Altoona Area High School, grades 9 through 12, will all be opening under this model for the start of the school year. The junior high school and elementaries will be dictated by the number of requests and grade level requests that we receive from the intention surveys that will be sent out tomorrow. The Altoona Cyber Academy is a cyber option where students are provided with an online curriculum that is facilitated by Altoona Cyber Academy teachers. Students will have a defined curriculum with flexible instructional hours based on their needs. At our elementary level, K1 and 2 students utilize Edgenuity as their defined curriculum. Our 3, 4, 5 students use Odysseyware as their primary curriculum. Those two programs are facilitated by teachers during flexible instructional hours that will be during the evening and at other times throughout the day. One question that comes up frequently in the phone calls that we receive are parents inquiring about homeschooling. And just to clarify what homeschooling means, homeschooling is when a family decides to commit to providing the education to their student with a curriculum and goal submission annually by the family that is then reviewed and approved by the school district. This does require a homeschool certifier to attest to the fidelity and the completion of the goals by the family. So the four options really at this point are a traditional model where students are attending school. You have a virtual model, which what we did in the spring would mimic a virtual model. The Altoona Cyber Academy is a full-time cyber-based curriculum offered K-12, and the curriculum varies by the level of the student. And then homeschooling would be a situation where the family is committing to providing the education to their student in a home setting. I know this is an elementary presentation. We feel that it's important for our families to be aware that due to COVID-19 related delays, our high school construction project and renovation is a little bit behind. So it has been decided that for the safety and continuity of our students, the high school students will begin their school year in a fully virtual setting. Details will be forthcoming, but beginning on August 31st and continuing through the month of September, all high school students will be educated through a synchronous and asynchronous virtual instruction. This will be evaluated on a weekly basis through September 25th, 2020. All students will be provided with a Chromebook and instructional materials to actively participate in this learning environment. Just to re-emphasize what our virtual programming, all of our teachers, obviously were thrown into a completely new way of educating students in the spring. We are conducting professional development as well as training for all of our staff to enhance those offerings that we had last year to include much more direct instruction and what we call synchronous education, which would mean that even though it is virtual, there will be a lot more, whether it be through video or Zoom or other platform, direct instruction and contact between student and instructor throughout the week. There will be some asynchronous pieces where students will be working on project-based activities in addition to other instructional materials, but that is the difference between virtual versus our Cyber Academy. Okay, at this point, I know we're in a webinar setting, so let me expand this. There we go, got it. We did have a number of questions that were submitted prior to, so I want to read those questions and then provide answers to those. As we're doing that, if questions come up, there is a chat window that is open that you can provide any additional questions that may come up as we move through this. So from the elementary perspective, some of the primary questions were very specific pertaining to individual students. So the first one is, what if a child does not feel comfortable wearing a mask, for example, children with glasses? Mask or face coverings are a requirement by the state of Pennsylvania, unless a child has a medical reason not to wear or if social distancing can be maintained. That being said, we want to make sure that all of our students are comfortable with their face covering, which is why we are encouraging all of our students and families to provide their own face covering. However, we will have disposable face coverings and face shields available for students. If you have an individual circumstance that you would like to discuss, we'd encourage you to contact myself, school district administration, or your building principal so that we can make accommodations and arrangements for your individual circumstance. Second question is, what if the child forgets their mask at home? Once again, the school district will provide for the student, and we'll have them available on transportation in addition to all of our buildings. Will they still have recess and go outside? Social development is a concern, especially for younger students. Absolutely. We will take steps to maintain social distancing and to practice safety while doing so, but we will have recess and students will go outside and participate in a normal school day as much as possible, while maintaining the distancing requirements and the safety precautions that are mandated by the state of Pennsylvania. What is the school district's plan to serve children during this pandemic in regards to substitute teachers? We are constantly working at providing a substitute teaching pool in the event that we have instructors or staff members that are not able to attend work for whatever reason. We work with a provider called ESS to do so. But one thing I do want to kind of promote is we're always looking for guest teachers. So if there's anyone out there that would be interested in becoming a guest teacher, which would allow you to substitute in our school district, we'd encourage you to contact our human resources office and they can walk you through the steps of doing so. How will attendance work? If say a child gets sick and it's not COVID, do they still get penalized for missing more than 5 days? Attendance is a vital part to ensure student success. However, we are very understanding that COVID and or any other medical issue may keep a child home from school. And I do want to emphasize and reiterate that if a child is symptomatic or if a child is exhibiting a temperature, we do want you to work directly with your healthcare provider to figure out what's best in your situation. But we do encourage students to stay home when they're sick, because obviously we don't want them coming to school and infecting other students. And we do realize there are challenges to that at times, but please communicate with your school nurse and communicate with your school administrators if there are special circumstances that arise. If students pack their lunch, will they be eating in the classroom or will they still go to the cafeteria? At this point, our plan is for all students to eat in the cafeteria, even for those that are bringing their lunch to school. Now, we may organize our cafeterias so that we have designated locations. One of the things that we are looking at planning for our elementary is pre-ordering in the morning so that lunches can be prepared and delivered to tables that are designated for students, where we can maximize social distancing and make sure that we have safety protocols in place. But yes, absolutely, our students, if they like to pack, they are more than welcome to pack their lunch and bring it to school, and they would eat in the same location as all other students. If reopening has to be distance learning, will the class be streamed live, or will it be more of what happened in the spring? And I guess the answer to that is yes. Both situations would exist where we will engage in synchronous learning in addition to asynchronous components, depending on the schedule that is developed for students to have direct contact with their teachers. You would definitely see an environment with increased rigor compared to the spring, as well as normally graded and evaluated classes and assessments, as opposed to what was pass-fail in the spring. There would be, a regular rigorous educational model presented with assignments and activities and submission times that will be evaluated by our teachers as if they were in a regular classroom. If you know your child has seasonal allergies that cause runny nose, congestion, will they still have to act as its COVID symptoms since they are listed on the symptoms of the reopening plan? If other conditions explain symptoms that students may exhibit, we encourage you to consult with your physician on what the best course of action is in terms of medical planning for your children. We do realize that there are pre-existing conditions with students, that there are other medical conditions that may exhibit some of the same symptoms. And once again, we highly encourage parents to have regular communication with their healthcare providers in terms of their students' health. With the symptoms list, it sounds like a common cold is going to cause a lot of absences. And it is typically hits my kids about a week into school every year. Should we assume that absolutely any symptom will result in staying home and isolating? We are asking parents to conduct daily health screenings. And if you feel that your child is symptomatic and may need to seek medical attention, we encourage you to contact and work with your healthcare provider. The one thing that we are definitely asking is if a child is running a temperature in excess of 100.4, that they definitely stay home and that you contact your healthcare provider for further consultation. If a teacher or student in a classroom tests positive with COVID, does the class have to go into a 2-week quarantine? We are required by the Pennsylvania Department of Health that anytime we are notified of a positive case, that we will work directly with the Pennsylvania Department of Health on what the next steps are in terms of notification, in terms of possible quarantine, and in terms of what needs to happen in the school environment and school setting to make sure that you take care of that situation if a positive case would exist in your school building. How will you ensure the inability to identify students due to mandatory face coverings does not affect the safety policy, thus causing a graver safety concern? I mean, obviously, health, safety, and wellness is one of our most important aspects here at the school district. It's the forefront of all of our decision making and everything that we do. Once our teachers obviously are acclimated with their students and get to know them well, you know, we're confident that a face covering will not inhibit our ability to identify students at either the elementary or the secondary level. At the secondary level, all of our students are issued school IDs, which they are then identified by as well throughout the school day. So we don't feel that it's going to add any type of safety concern in terms of students wearing face coverings. All of our buildings at the secondary level are monitored by security greeters. We have a full-time school and safety security force that monitors all of our buildings and properties, and we will continue to be very vigilant when it comes to making sure that we are keeping those who should not be in our schools out of our schools. Will transportation be limited due to smaller numbers? Absolutely not. All eligible students that are eligible for transportation will be provided with appropriate school district provided transportation. Will face shields be provided so that children can see the teacher's face? Face shields are an option for all of our instructional staff as well as our students. We have procured those items and have them available in all of our locations if it is requested by either an adult or staff member in the building, or if a student cannot provide their own but would like to have a face shield as opposed to a face covering. How will parent volunteers be handled? We're currently evaluating those requirements at the elementary locations that do require parent volunteer hours, and there will be more information coming out specific to volunteer hours. Will class sizes be made smaller? Our current class sizes are relatively small as it is. Our averages are between 18 and 24 students at both the elementary and the secondary level, and that's if everyone is attending brick and mortar traditional education. If we do have students that are choosing and opting for a virtual and or cyber option, that will decrease the number of students in some of our classes, and we will be looking at balancing those classes to make sure that we don't have too many students where social distancing cannot be maintained. Are you still having ABC camp, and what precautions are being put in place? We are still having ABC camp, and that information will be coming out for those parents of incoming kindergartners. What we are looking at is we are limiting the number of each class to 10 to 12 students per one teacher, and the number of sections that are necessary at each building will be provided along with appropriate instructional staff to make that happen. All of the safety precautions that we have in place for the start of the school year, we'll get a test run during ABC camp in terms of our sanitizing processes. And, you know, we fully expect kindergartners to be one of the most challenging populations with face coverings. So it will be a good opportunity for us to look at and gauge what that process looks like in the classroom, and helping the little ones and educate them on the importance in maintaining that throughout the school day. How will you handle guided reading and small group instruction? So we do want to provide the caliber of education that we are accustomed to, and included in that are utilizing instructional approaches such as small group instruction, guided reading, and so on. So to do that safely, we need to practice social distancing and wear face coverings when we are in a mode in the classroom where social distancing cannot be maintained. So anytime that we are utilizing small group, where we're doing guided reading, or what we're using as our readers workshop model, when we are bringing kids in closer proximity to one another, or if a teacher is working individually with a group of students or an individual student, we are requiring the face coverings when that social distancing cannot be maintained. How will special ed and IEPs be met if choosing an online option? It's a great question. Accommodations, SDIs, related services will all be modified and adapted to meet the virtual and or cyber option for all of our students. Case managers will work with our special education supervisors and directors on making sure that we are providing students with the accommodations and the modifications that they need to help them be successful in a cyber and or virtual environment. And that was something that we worked on very diligently in the spring to help make sure that all of our related services and what students need individually doesn't change just because it's a different environment. IEPs are individualized plans, and they'll continue to be so, and they will be delivered and carried through by our instructional staff. What is the district doing to prepare teachers for virtual learning? It's a great question. So we are in the process right now of planning professional development prior to the start of the school year, along with collaborative planning time that our teachers will be able to work together to plan virtual instruction. They were thrown into the fire in the spring and did an outstanding job at adapting and modifying, and really got a great experience in terms of how they can adapt their instructional practices and models to meet a virtual environment. So we have a good basis to start with, really good foundation, and we'll be expanding on that as we move forward. Depending on the options available, if it's the cyber option, we'll be training teachers on the two different platforms, Edgenuity, as well as Odyssey-ware, to deliver that instruction. And for virtual instruction, we will have teachers collaborating and working in grade level and subject-specific teams to plan instruction for what that will look like in both synchronous and asynchronous environments. How will the district handle medical conditions for masks? If students have medical conditions that prevent them from wearing a mask, we would look at other options. If a face shield is something that would work for them, we would look at wearing a face shield. But if students are absolutely not capable of wearing any kind of face covering or face shield, then they have a medical exemption to the face covering rule. How will you address different learning abilities? If children do not move classes, how will this be handled? Like we had mentioned earlier, when possible, teachers will move to students to limit student movement throughout the school day. Depending on, I'm not quite sure what this question is getting at, but we will meet the individual needs of every student. So if we have students that need to have more enrichment, or students that need to have some remediation or reteaching, we will be able to group students and move students, whether it be to instructors or instructors to them, to make that happen. Next question is kind of multi-part. What curriculum is used for cyber? As we had mentioned, K-2 uses Edgenuity, 3-5 uses Odyssey-ware, and our 6-12 cyber school uses district-aligned teacher-created curriculum that is in line with the brick and mortar curriculum. So students that are in a secondary cyber situation are basically have an aligned curriculum that if they were in the brick and mortar, they'd have the same scope and sequence that they would as if they were in a virtual setting. School aligned curriculum is reviewed and updated on an annual basis. There are modifications made based on Pennsylvania standards and alignment. All of our scope and sequence are looked at on an annual basis to make sure that we are covering all of the required materials that are appropriate for the grade level and the subject specific. The model of instruction, I've used the word synchronous and asynchronous a number of times. Synchronous basically is kind of like what I'm doing with you right now. I am having a lesson that you are able to view, collaborate with, interact with, and follow along with. Asynchronous would be similar to what we had done in the spring, where we provided activities, lessons, videos, and other platforms that students could work on independently with facilitation from their teachers. Are students assigned one teacher or multiple? Well, that will depend on their individual schedule. At the elementary level, whoever would normally be in charge of their instruction during the school day would be responsible for their virtual instruction as well. Students at the junior high school and high school typically have 8 periods during the day. So those students would essentially have 8 teachers that would be providing them with their class level instruction in a virtual environment. If it's in our cyber academy, there would be teachers that are assigned to teaching the various classes that are offered to our cyber students. Where can I access more information about assessments? Depending on what platform they're utilizing, the school created and local assessments are created by our teachers and posted and shared with parents on their Google Classrooms. If it's specific to Odysseyware and or Edgenuity, those programs can be accessed online, and we're working on putting together a web material on our website that gives parents more specificity as to those curriculum areas. Okay, some other questions that have come in. Is virtual or cyber? There are both options, okay? When we had outlined what the options are and what you will see on your intention survey tomorrow are both. You will have the option of brick and mortar, which is our traditional setting, virtual, which means that your child will be basically attending school every day during normal hours, 8 o'clock to 3 o'clock on a daily basis, and they will be instructed both synchronously and asynchronously by the teachers from the home school. If they are involved in the Altoona Cyber Academy, it's a lot more flexible. They will be working with a defined curriculum, either Odysseyware or Edgenuity, that will be facilitated by a school district employee during primarily off school hours and then throughout the school day as needed. There would be office hours, there would be email communication, but it would be more facilitation of learning that is going to be self-guided through those programs, as opposed to virtual, which will be daily interaction with teachers in a virtual environment. What will the transition look like from a face-to-face and a virtual and back? Well, and that's a very real possibility. I mean, obviously we are at the whim of the state, and if we open virtually and if something would happen in terms of the health and safety and wellness of the state, and we are ordered to go back to a virtual environment, we feel like we can do this relatively seamlessly. Our elementary students would be provided with devices, Chromebooks at the grade levels of 3, 4, and 5, and devices that we can then distribute to K1, 2 if there's a need at the home. We would also look at providing an internet access if parents do not have that, and be able to provide that synchronous virtual learning option. If it would then going back is relatively easy. We just say that at that point, those students that want to continue in the virtual environment, we can continue. Those students that want to return to brick and mortar, you'll return to school on Monday or Tuesday, whenever we decide to reopen. The intention survey that's being sent out, you are not locked into that. So what we're trying to get is an idea of what the numbers are going to be of the requests for the various options. So you are not locked. If you commit to a virtual option, does that mean that you cannot say, well, I want my child to return to school? Absolutely not. We will consider those transitions whenever possible for all of our students. Our virtual will mirror the in-school curriculum. So whatever your child will be getting, if they return to a traditional setting, they will get as close to that in terms of the rigor and the curriculum and the materials in a virtual setting, in an online setting, as opposed to being, reporting to school. So I know that's kind of a little bit of a point of confusion. What's virtual versus Cyber Academy? When you are requesting to enroll in the Cyber Academy, the understanding is that your child will basically be committing to asynchronous learning with facilitation by our school district employees. And they will be assigned into the appropriate program, whether it be Odysseyware or Edgenuity, as we move forward. Will Chromebooks be provided for grades 4 and 5 and for those in need? And I think we talked about that. They will be provided. We've been able to procure devices actually for our 3rd, 4th, and 5th graders. And if we need to go to an all virtual environment, or if we have students that are selecting the virtual environment, those Chromebooks will be provided along with assistance with internet access if necessary. Can we change the model if cases? Yes, if you're concerned with with cases, I'm assuming we mean COVID cases, can you move in and out? For consistency purposes, we want to try to maintain as much as possible marking period benchmark. So if you commit to one, staying in that through the marking period would make the most sense. In our experience in working with cyber academies and students in multiple environments, the transitions back and forth happen best typically at marking period times, but we would do that as quickly and as efficiently as possible, depending on the individual needs. Will sick days be more lenient? We're in the discussions right now that will, at least for this year, suspend the requirement that after 10 school days or 10 missed days, that parents are required to have a doctor's excuse for subsequent absences. Because essentially we are telling you that if your child is symptomatic or if your child has a potential to need medical care, that we want you to keep them home. So that being said, we are looking at modifying some of the attendance requirements in terms of requirements for doctor's excuses. We're going to put the discretion on the parents and working with your administrator. And obviously communication is the key there. If you have a circumstance or if your child is getting up in the number of days, we would encourage you to have a conversation with your building administrator to discuss your individual circumstances. For the virtual option, the question was, are there daily deadlines or week-long deadlines? And the answer to that would be yes. There probably will be activities that will be on a daily basis where you may be asked to watch a video, respond to a prompt, complete a Google form, complete an activity. And there may be some activities that are more long-term, like you might be writing an essay or doing a webinar or a web quest where you're researching a topic and you're doing producing a product that's then going to be submitted over a period of time. I would say it's going to look a lot like your regular school setting, whereas you might have nightly homework, but then you also have assessments and you have projects and papers and things that are more of a long-term assignment that are done over a period of time. So can cyber have online interaction with peers in class? Absolutely. Our secondary experience, we have Google Hangouts and Google Meets where classes at the secondary level do that. At this time, our first year of elementary cyber last year, we did not get into direct socializing because of the platform being different. They are locked into utilizing a program that they are working through relatively independently with parental support and then facilitator support on the school district end. Okay, do we have any other questions coming in? Okay, we are not seeing any further questions, but I'm sure that actually there's a couple popping in now. So we'll kind of hold off here a second, but hopefully we have answered a lot of the pressing questions. I would encourage you to go to the school district website and the COVID page. We have a frequently asked question document that is present there that answers a lot of the pressing questions that we anticipate that parents may have. Also, as I mentioned earlier, we do highly encourage you to contact your building administrator or contact myself. If you have any specific questions or concerns, or just would like to talk through some of the options, once again, please check your email tomorrow as we move through. We will be sending out the intention survey. We'll also have links to that survey on social media. Please only complete the survey once. And if there are multiple families or if there are children between families, please coordinate that with each of the stakeholders so that there's only one survey submitted per family. And there's a space to put multiple children in on each of the surveys, so you only need to submit one survey once completed. Okay, we have another question coming in. If a positive case, will parents be notified? We are committed to letting parents know of positive cases as soon as possible. Our protocol is that when we are notified of a positive case, we will immediately contact the Department of Health, and the Department of Health will come in and they will direct our communication with families in addition to next steps. So if that would include any type of quarantine, any type of school closure, any type of special deep cleaning process, that would be directed by the Department of Health and the Department of Education. So we will notify parents as soon as we possibly can. Our goal is to have something out to parents within 24 to 48 hours. 504 plans identify extended time. Can they have longer and help fit parents' schedule? Absolutely. Anything that is accommodated in a 504 plan or an IEP, including specially designed instructions such as extended time, will apply to a virtual or an online model. The IEP and the 504 are documents that live. They may need to look at being modified to fit the virtual environment. However, those are documents and accommodations for students that will be implemented just as we would in a regular brick and mortar setting. Our electives, like band, offered for cyber. They are not offered for cyber. However, we do have situations where our students engage in a hybrid learning model where they are engaging in cyber, ACA cyber for a lot of their core classes, but then actually attend our brick and mortar for co-curricular classes such as chorus, band, and orchestra. So that is a possibility. Once again, we want to make individual accommodations to meet the needs of our students, including the co-curriculars such as the music department. What about special needs children? Obviously, our most needy populations are at the forefront of our planning process. We do realize that special challenges exist for individuals that have, whether it be medical or learning needs, and we will make every effort working with our instructional staff, our case managers, and our special education department and service providers to make sure that we are servicing all of our students to the best of our ability and making sure they have everything they need to be successful regardless of the environment that they are learning in. Will PTO be able to fundraise or fundraise? Okay. Our parent organizations are a vital part of our schools. And obviously, we would want to maintain the same protocols and same safety precautions that we would with our students as we would with our parent groups. So depending on what type of fundraising that we're talking about, I know that I talked to Mr. Detweiler, our department head for music, today about what that will look like because they're not going to have the availability of concession stands and things to generate resources for our students. And they are looking at options. They're working with their parent teacher or their parent organizations, as I'm sure PTOs will do at the elementary level, to look at what are fundraising options that are available and getting creative, with working with your building administrators and working with administration to come up with solutions to those fundraising efforts if they're possible. Will employees and students be required to wear masks and not shields unless they have a medical reason? Yes, they absolutely will. It is a state requirement that students that do not have a special circumstance, such as a medical circumstance, are required to wear a face covering. We've talked to numerous people, including our solicitor, about that very question. From a staff standpoint, it is a condition of employment. And from a student standpoint, it is a condition of attendance that they are compliant with the expectations of the school. So if students have special medical considerations, they obviously they will be exempt from some of those requirements. However, just not wanting to wear one is not an adequate reason to not wear a face covering. And we feel like we have other options in terms of their education, whether it be virtual or cyber, for those students and their families that are adamant about that. And we can work with you on this. Obviously, our goal is to find common ground and a solution so that your child can get the best education possible. Can TSSs and BSC services enter? I'm assuming you're referring to like therapeutic staff support, behavioral supports that come into the building. And the answer to that is obviously yes. They will fall under our requirements in terms of the daily health screenings and daily health checks. We ask to do them at home, but our staff members will be conducting health screenings on one another as well prior to the start of the school day. So our outside service providers, whether it be counselors, whether it be liaisons from the hospital, whatever it may be, they will fall under the same restrictions and guidelines that our staff members do to provide services for students. So if they're meeting in a conference setting or if they have a session, then yes, they would be required to wear a mask, and they would be required to practice social distancing. If they're working with a student in the classroom, we would need to look at that individual student needs in terms of, what the TSS's role are, what the BSC service, what the purpose of that is within the school, and make sure that we make accommodations to meet their needs as well. The school will screen daily. Our temperature screen will take place as students arrive at the building. We are eliminating morning clustering of students, or arrival patterns, bus patterns, and we are actually working with our teachers on starting their day a little bit earlier, so that once students have entered the building, they are not going to a large group gathering area. They are going directly to their classroom, and when in the classroom, that's when their health screening will take place. How do we set up for virtual? I'm assuming that's the parent asking, how do we request the virtual? When the survey comes out, you want to indicate that you are preferring a virtual option. And at that point, all of our buildings, including our high school, junior high school, and elementary programs, will coordinate device distribution prior to the start of school and some type of orientation, so that parents and students are comfortable and familiar with what that platform will actually look like. So that is in the planning process right now, and definitive dates will be published to our families once we have those ready. Will students have more than one teacher? More than likely, yes, regardless of level, but at the elementary level, we do have teachers working specifically with a particular content area, such as math or ELA, science, social studies. They will have multiple teachers. So when possible, those teachers will travel to the student, but they will be working with multiple teachers, whether it be in a traditional setting or if it's in a virtual setting. They will have multiple teachers that they will be working with. Will we have sports? That's a great question. And I know that's a burning question with a lot of our community. We hope so. We feel very passionately that our extracurricular programs are a vital part of the educational piece. And once again, that is dictated by PIAA for our 7 to 12 sports. For our elementary sports, that will be looked at by AFL for football, and then also the CBRC, the Blair Rec Commission, for the athletic offerings for our elementary students. So we will maintain close conversation with them regarding what their directions are going to be. And like most parents, I think we are all hoping that we are able to have Mountain Lion athletics throughout the school year. Is LLI virtual? We experimented with LLI virtually in the spring and had some pretty good success with it. So yes, LLI, which is level literacy intervention, will be offered as a direct reading intervention for students that have that need. It doesn't look exactly the same, but it can be facilitated in a virtual environment, and we're excited to provide that where necessary for our students. Does a school have to quarantine if there's a positive case? Once again, I think I had mentioned, depending on if there's a positive case in the school, we will work directly with the Department of Health in terms of notification and what the restrictions are going to be at the school level. It could vary anywhere from quarantining direct contact to quarantining the entire school to temporary shutdown. That we won't know until we are given direct instruction from the Department of Health and the Pennsylvania Department of Education. Could I sum up my major points? Sure, because we're kind of getting to the time here. Major point is we are very excited to return to school. I know students have missed school. I know parents have missed students going to school. That being said, we are very aware that all of our parents have different concerns and different needs and requirements. And we want to be able to provide as many options as possible for our students to experience a positive education as we move into the 2021 school year. So basically, next steps is, as our survey is coming out tomorrow, we'd encourage you to communicate with any families that you're aware of that we're not able to get on tonight, and complete that survey so that we are then able to evaluate what our numbers are and the intent of parents to either engage in our traditional setting or one of our 2 virtual options, our Cyber Academy or the virtual option. Okay, just a couple more questions came in, and we'll finish these up, and then we're gonna move on. Will Lily Pond after school care be offered as it exists right now? Yes. In a traditional setting, if we are able to return to a traditional setting, Lily Pond before and after school care will exist in all of our buildings. If we choose virtual, will students be provided with books and materials if necessary, as dictated by the instructional staff? Depending on what the curriculum is, they may need a textbook and or reading books and or other materials that can be pushed out either through Google Classroom as viewable documents, or other means necessary through their Chromebook. Will you place kids that can't wear a mask together and those that can together? We had talked a little bit with our attorneys the other day about super social distancers. If we have students that are very, very susceptible and need to have a higher level of social distancing, not just the mandated 6 feet, that we will make accommodations for students that require what we refer to as super social distancing. That being said, we don't want to isolate any students or make them feel like that they are not a part of the regular ebb and flow of the day. So we'll work with families if certain individual circumstances exist and come up with a plan that you are comfortable with to accommodate your children. Will PSSA or state testing happen? We don't know. That is something that will be dictated by the state, and that will be, obviously it didn't happen last year. I'm sure that they will try to make every effort to conduct state testing, but that's a to be determined later. And just want to remind everybody as we kind of close for the evening, I want to thank everyone that did get on. You can watch a repeat of this. This is being recorded and will be posted to the Altoona Area School District YouTube live page. So on behalf of the school district administration and our team, just want to thank you for attending and participating tonight. And once again, if you have any further questions, please do not hesitate to reach out to your building administrator or myself. Good evening.